There we go. Our conversation with Natalie Boyle is brought to you by Marcus and Mack, a law firm representing injured people. Natalie is the CEO and founder of Mommies in Need, which is a nonprofit. And we're going to talk today about mommies who are in especially dire need right now of child care, because child care costs are just, they're wreaking havoc. So let's find out what we might be able to do about that with Natalie Boyle this morning. Natalie, good morning.
Good morning. Thanks for having me on.
You know, you are my second Dallas person here today.
Well, showing up strong, representing Texas.
There you go. There you go. Well, I want to talk to you about this topic because this is a serious one, and it is impacting families all over the world, moms especially. Inflation is, we talk about the effects of it and how it reaches into every home. This is in an especially difficult way. Child care costs are just skyrocketing, and we need to find a way to get a handle on it, and especially to help out moms. Natalie, as you know, this is really hurting for moms especially, isn't it?
Yeah, parents want the best possible care for their kids, but right now people are having trouble finding it, and even if they can find it, they're having trouble affording it, right? It's this lack of availability in addition to the high cost that's causing parents, and as you mentioned, particularly moms, to leave the workforce in just huge numbers. Which, for a lot of families, they're actually paying, child care is their number one expense. For some families, it's more than their mortgage or rent. It is a significant portion of income. And, unfortunately, that leads to a lot of people having to leave the workforce, not getting to choose whether that's, of course, we love when parents choose to be a stay-at-home parent. That's fabulous. But, if somebody's got a huge amount of student loan debts because they've gotten a master's and love what they do, we want them to be able to have that choice to continue working.
Give us an idea of the perspective here. We hear numbers such as anywhere from 30 to 35% for child care now of a family's average income, and especially of a woman's average income. How much worse is that than it used to be?
Yeah, so it is a pretty huge step up. We're talking probably a 10 to 12% rise. So it's ahead of the 7% inflation. We're talking about this is a really significant rise in the cost of childcare, and that comes about for a couple of reasons. One is this lack of availability. A lot of small child care centers weren't able to make it through the pandemic and have not reopened. So there's a supply and demand problem. And again, with as many industries are having trouble filling roles, that is especially the case in the child care industry. And so some places are having to reduce their class sizes because they just don't have enough teachers.
Does this put extra pressure as well on businesses then, without the value of the women employees who are having to leave their careers, at least temporarily and maybe even permanently? Obviously, that's a pretty vicious cycle for the companies at which they work, too.
You're exactly right. And, I will say it's a vicious cycle, but it's also one of the places we're seeing the best innovation is with employers stepping up to help alleviate that burden of childcare because they see such direct results. So, some places are providing a childcare stipend or some kind of help with paying for childcare, and other larger places are actually putting in childcare centers where they may never have had it before and starting to see the benefits. So, for example, our organization, Mommies in Need, we work with hospitals, and so we provide free childcare for patients that are getting medical treatment, but also with opening childcare centers that are even focused on kind of those lower income hospital employees without whom the whole thing shuts down, right? So it's the techs and the janitorial and the cafeteria services, which if you don't have those, the hospital shuts down. And the research we're doing with employers is showing that, by providing on-site childcare, businesses can improve their recruiting, they can reduce absenteeism, they can increase engagement, and they can even see a 35 to 60% reduction in turnover. And that translates to a lot of dollars.
Yeah, absolutely. And I'm sure that moms have a great level of comfort knowing that their kids are right there in the same building that they are. Those larger organizations are able to provide that. For those smaller organizations, and then to take it back to the family level, it's not as easy for them. And so we need to find solutions for them. And I know that Mommies in Need is an organization that searches for solutions. What are you finding?
So, there's a couple different things. I mean, there are a lot of organizations that are doing some really good work in trying to help create small home-based child care centers, and that would be particularly in areas that maybe aren't as well populated, but where you can have, these small home-based centers where people are, watching 2 to 10 children, and that's a really great solution. We're seeing parents doing co-op kind of situations as well, and so people are getting creative, and then employers that aren't able to provide on-site child care are sometimes partnering with child care centers to, kind of help subsidize the cost. So maybe they're just contributing a bit or helping reserve some of those spots for their employees.
You look down the road 5 or 10 years and you say, is it going to continue to be such a big problem? And is this something that's going to snowball or not? And then you also then ask yourself, well, what are some of the solutions we're finding today that might help to make sure that it doesn't end up that way?
Yeah. Well, another thing that we're seeing, for example, in Dallas is having younger kids be part of the public school system, right, of being able to extend pre-K classes to start at 3 or 4 years old. And so then that helps alleviate that burden because parents are only needing to find childcare for those first couple of years. And then a lot of really great work is happening in the nonprofit community to advocate for childcare centers to help set up a better network. But yeah, it's a large problem, and it's going to take some really creative and collaborative solutions to actually make a huge difference with it. Well,
speaking of nonprofits, you're the founder of Mommies in Need. Tell me about Mommies in Need.
Yeah, so we really started, I am a cancer survivor. My twins were 18 months old, and I was a stay-at-home parent when I got ill, and of course couldn't take care of my children because I was in the hospital so much. And so as I recovered, I started this to help other moms that were going through a health crisis, and kind of what that grew into is really saying that, child care and health care, where that meets, that's where Mommies in Need steps in. So it's caring for kids so families can access health care. And during the pandemic, we opened a child care center at a hospital for patients. But what we discovered was a lot of hospital staff were calling into work. They weren't able to show up because they didn't have child care. And so that's really how we expanded into now providing child care centers for those hospital staff, because if the staff can't be there, then our patients can't get treatment, and so we really believe that is a part of healthcare access as well.
When something is successful, of course, word leaks out pretty quickly, and others jump on board with it. Have you been hearing from others who have seen Mommies in Need and the way that it works and said, we can do that here too, but we just need help getting started?
Yeah, absolutely, and it's something that we're very interested in working collaboratively. We are also expanding our business models to hospitals throughout Texas, and we'll be expanding to other states as well. And so I really encourage anyone that's interested in doing this for their company, they're happy for them to reach out to us at mommiesinneed.org, and we can help connect them to resources in their area. Natalie
Boyle is the CEO and founder of Mommies in Need. Natalie, as we do consider the cost of health care or child care and health care as well,
sure.
And we think about what it's doing to families right now, obviously it's something we'd like to get a handle on as quickly as possible, but we want to do it the right way, don't we?
Yeah. That's exactly right, and you want to make sure that you're also providing the best possible quality of care for the kids.
Yeah, absolutely. All right, so folks want to learn more about Mommies in Need. You said the website a couple of seconds ago?
Yep, mommiesinneed.org.
All right, beautiful. Natalie Boyle, thank you so much for visiting with us here today on Indiana in the Morning.
Thank you for having me on.
Have a great day.
All right, you too. Bye-bye.
It is the voice of Indiana County. It's WCCS 101.1 FM and AM 1160.